Welcome to the introduction of the post-birth alert system. I am Molly Hogan, postpartum nurse manager at Maine Health Maine Medical Center in Portland. I'll be walking you through the implementation of the post-birth alert system here at Maine Health. Throughout this presentation of the post-birth alert system, we will reach these main objectives: to educate EMS, emergency department, and maternal health care providers on the implementation of the postpartum birth alert system, and to inform these providers on their role of acknowledging a postpartum patient and gearing assessment towards the highest risk diagnoses for mortality and morbidity in this population. We have made it our mission to bring awareness to complications the postpartum patient is at highest risk for within 6 weeks of delivery, to decrease morbidity and mortality in the community we serve. Our vision is to collaborate with community healthcare providers, EMS, emergency department staff, maternal health nurses, and patients to increase awareness related to complications of the postpartum period. As healthcare providers of any kind, we always like to know statistics so we can make sure that we are making the biggest difference. In 2022, the CDC reported 817 deaths in the postpartum period. More than 2/3 of postpartum deaths were deemed moderately to substantially preventable. While it does not seem that 817 birthing persons dying throughout the country is a staggering number, it is still a child without a parent and a partner without their loved one. This can affect you personally. The 2023 Maine Maternal, Fetal, and Infant Mortality Review Panel identified that 86% of pregnancy-associated deaths in Maine occurred in the postpartum period. They also determined 100% of these deaths were preventable. While the number of total deaths may not seem like a lot, if we can prevent even one of these, we can touch a lot of lives that would otherwise be impacted by that one loss. Additionally, the potential for a reduction of morbidity related to postpartum complications has the potential to touch families across the state. As an emergency provider, whether it be EMS or emergency department, you may be wondering how you are going to recognize a postpartum patient. Before discharge from the hospital, each patient will receive this post-birth alert bracelet. This will be a bright orange bracelet with large writing that states post-birth alert. With the support or support persons present, the nursing staff at the hospital will educate the patient on the importance of wearing the bracelet to alert EMS personnel and emergency department staff that they have delivered in the last 6 weeks. This can help to direct the care and assessments you give to this patient to help identify and manage postpartum complications. Patients are currently extensively educated before discharge using the post-birth alert sheet that the Association of Women's Health, Obstetric, and Neonatal Nurses has created to review each of the 5 complications that are at the highest risk for morbidity and mortality. At the time of reviewing the sheet with the nurse, the patient receives this orange band. Once the patient has had a 6-week follow-up appointment with the OB provider, the birthing person will then be educated to stop wearing the bracelet. It is essential the support system also knows the reason behind wearing the bracelet, because there may be a situation that you are called to in which the patient is unable to speak for themselves. Now that you have determined the patient is a postpartum patient, you can start to direct your assessment to whether they are experiencing a postpartum-related complication. These are the 5 highest risk diagnoses for morbidity and mortality in the postpartum patient. If you see the band, you can start to gear your assessment towards these top 5 diagnoses. Target assessments related to these postpartum complications would include looking for preeclampsia or eclampsia, sepsis, perinatal depression, substance use disorders, cardiomyopathy, or venous thromboembolism. The implementation of the post-birth alert system is intended to expedite collaboration amongst the healthcare team. When the patient is known to be postpartum and having symptoms of one of these top 5 diagnoses, the emergency department staff can then get into contact quickly with the OB staff at the hospital to collaborate care more effectively. Communication and collaboration are key to saving lives. And if we can all get this done quickly and more efficiently, we are sure to have better outcomes for these patients. Assessing the patient while keeping in mind these high-risk diagnoses will assist in working through organizational pathways for treatment, depending on the level of care that each department can provide. An example would be starting an IV for a patient who is exhibiting high blood pressure, so treatment can be initiated as soon as possible when presenting to the emergency department. Communicating these assessments to the hospital you'll be taking the patient to will help to better direct the care provided once they arrive. It is essential to have a collaborative team caring for the postpartum patient, and together we can make a difference in lives across the state of Maine. Thank you for your time and interest in the post-birth alert system here at Maine Health. Please don't hesitate to reach out to either of the contacts listed below should you have any questions.